America, it is I, your President, Donald J. Trump, coming to you live from my basement. As we know, the United States is facing a tremendous threat, the likes of which we have never seen before. The leprosy pandemic is sweeping the nation. Now, I just want to reassure you that I am doing a tremendous job. I'm doing a fabulous job, probably the best job that could possibly be done. However, this press conference today was called in order to inform you, the American people. I have put together a panel with the Surgeon General and some of the top infectious disease experts so that we can tell you exactly what we're doing and how tremendous of a job I'm doing. It's going to be great. You're going to love it. Without further ado, I'd like to welcome Dr. Madeline Spohler to the table to discuss some of the specifics of this tremendous threat.
Leprosy is a chronic disease caused by Mycobacterium leprae that is treated with MDT, also known as multi-drug therapy. More than 16 million leprosy patients have been treated with MDT over the past 20 years. Based on the 2018 data, the prevalence rate is 0.2 out of 10,000, with around 152 countries worldwide reported cases of leprosy. In 2018, there were 208,613 new cases of leprosy detected globally. The countries that are most affected by leprosy include India, Brazil, and Indonesia. Leprosy can affect all races, although it affects most people.
Thank you, Dr. Spohler. That was tremendous. Now, I would like to welcome infectious disease doctor Dr. Adkins to come discuss some more specifics.
Hello everyone, this is Dr. Adkins reporting to you from my home office. I just got home from an 18-hour shift at the hospital, and let me tell you, it is a disaster there. Many patients because of this outbreak. This outbreak has really caused a lot of turmoil, and as you can tell, I'm clearly exhausted. But we do have some information for everybody to let you know if you should go to the hospital or not, if you're experiencing symptoms, or what you should look for, what causes it, and what you should stay away from. So, as I've been working, I've noticed that the causes of it is a bacterium. It's called Mycobacterium leprae. So, it takes kind of a long time for it to reproduce in the cells compared to other cells. Other bacteriums and diseases, they can reproduce in the cell in hours and minutes. This one takes about 12 to 14 days. And after the 12 to 14 days, the body will start to reproduce antibodies. They're anti-endothelial antibodies, but we have yet to discover what the actual function of them are. So, the symptoms that you might be experiencing, you might have numbness, loss of sensation, nerve injuries, skin lesions. There's a pins and needles sensation. So the numbness, loss of temperature, and pins and needles are early symptoms. Skin lesions, disfigurement, and blisters are more later symptoms. This disease, it may take a while for symptoms to even appear. So if you know you came in contact with anybody, I would go get tested. But if you're not experiencing any symptoms and you don't know, you won't know for maybe a couple of years or a year or so. There are two major forms of leprosy that were mentioned previously. It's the lepromatous or the multibacillary leprosy, and then the paucibacillary leprosy or the tuberculoid leprosy. So they have different symptoms. The tuberculoid leprosy, it's the less serious form of leprosy. You'll have little skin lesions. It may disappear on its own, honestly. It could get worse, but it may heal on its own and there may be no problem. The lepromatous leprosy is the more serious one that you need to worry about. This one can cause major symptoms. You'll have way more skin lesions than in the tuberculoid leprosy. It may even lead to anemia, and in this one, you can have hair loss, there's severe disfigurement, and you may have loss of digits. So, as I said, if you're experiencing any of the early symptoms such as numbness, pins and needles, there's loss of temperature sensation, you may need to go visit the hospital and make sure that you do not have leprosy, which you may, and it needs to be caught before any severe symptoms show up. Because if you are diagnosed with the lepromatous leprosy, It may even develop into having anemia and the severe disfigurement and loss of digits. So please, if you know anybody or you have these early symptoms, go to the hospital.
All right, we will now be opening up to some questions from the fake news. Um, who's first? You over there, Mr. CNN guy. Terrible news network, by the way. But go ahead with your question.
Abel Castillo here from CNN. Doctor, there appear to be some conflicting reports about the exact immune response induced by exposure to leprosy in this most recent outbreak. Could you shed some light on these details for the sake of educating the millions of Americans watching from home?
Leprosy is known to affect the nervous system, and we'll dive a little bit deeper into understanding the interaction between the immune response and the nervous system. So, leprosy is known to affect the nerve, skin, lining of the nose, and upper respiratory tract, which can cause inflammation of the nervous system, demyelination of nerves and ulcers, and muscle weakness. Macrophages, dendritic cells, neutrophils, and keratinocytes are the major cell populations, along with cytokine release and antimicrobial pathways that mold the immune response against leprosy. So, Mycobacterium leprae is an intercellular pathogen that invades the macrophages and replicates within these cells. So, during the innate immune response, bone-derived monocytes enter the tissue, and they take part in defense as they differentiate into macrophages. So, host cells recognize these pathogens through molecular pattern recognition and can also be recognized through complement and TLR. Keratinocytes express mannose binding receptors, TLR, and class II MHC antigens. And these keratinocytes will secrete various cytokines, chemokines, and antimicrobial peptides, which induce immune responses important for the epidermal immune response.
Thank you. Just one more quick question, Doctor. Is this induced immune response that you just described protective or pathogenic, or where is the line drawn between these two types of immune response?
So, overall, the immune response against leprosy is pathogenic due to the response of the pathogen, which we've talked about extensively, the Mycobacterium leprae.
You there from the New York Times. Go ahead with your question. You're next.
Huge thank you to you both for coming on and agreeing to answer a few questions I'm sure a lot of people are wrestling with during this time. First of all, what type of treatment can patients expect to receive in response to this disease?
So that's a really good question. So first, we have to decide whether the patient has the multibacillary leprosy or the possibilary leprosy. This can be done by doing a skin smear test. So the patients with the possibilary leprosy, they will have less than 5 lesions, and then they'll test negative for the mycobacterium I talked about previously in the skin smear test. But the multibacillary leprosy, they will test positive for the mycobacterium in the skin smear test and will have way more lesions than the people with the possibilary leprosy. So the treatment for people with multibacillary leprosy, they will be given rifampicin, clofazimine, and dapsone for a minimum of 12 months. But the people with possibilary leprosy, they will be treated with rifampicin and dapsone for at least 6 months. So obviously the people with the less severe leprosy will be treated for less months than the people with the more severe form.
Secondly, should patients expect any ongoing health concerns once they've finished with their treatment?
Another very good question that I did touch on a little bit before, but if caught early and leprosy patients are treated, there really is no long-term health problems. They can recover fully from it as long as it's caught early. If the leprosy is not caught, patients will eventually start to develop the disfigurement. There's nerve damage, and there is loss of digits. But once the leprosy patients are treated, they are no longer contagious. So, like I said before, if you or someone you know is experiencing the early symptoms, or you know you came in contact with someone who has leprosy, you should come in and get tested to the hospital to make sure that you are no longer passing on to anyone else and that you can hurry up and get treated before there is any serious damage done to the body.
We were able to have some of your questions answered today in this tremendous press conference. I just want to assure the American people that I will not rest until this leprosy outbreak is away, until it is gone and it's finished. We have a tremendous amount of resources We have great tests coming out every day. We're testing everyone. Everyone is getting tested, and everyone's getting treated. We have powerful drugs coming. I just want to let everyone know that I, Donald J. Trump, I am here for you. Thank you, America. Good night.